specialist who has trained at Harvard University, Harvard Medical School, Mayo Clinic College of Medicine, and the University of Iowa. She is also an accomplished author with a passion for challenging perceptions around chronic illness and empowering individuals to see possibilities beyond diagnosis. What truly drives Dr. Jerath's work is her patience, the resilience, the determination, and unwavering strength in the face of daily challenges. She is deeply inspired by the MG community, describing it as one of the most compassionate and remarkable groups she has had the privilege to serve. For her, this work goes far beyond medicine. It's about connection, understanding, and helping people move toward a fuller and more meaningful life. She also brings a unique perspective on wellness, believing that some of the most powerful sources of healing, joy, connection, and mindset are already within our reach. Today, Dr. Jerath will be speaking on lifestyle and wellness with Myasthenia gravis, offering insights on how we can support overall well-being. Please join me in welcoming Dr. Nivedita Jerath.
Thank you, everyone, for having me. How are you guys doing? Is everyone doing great? Yeah, we're going to have a lot of energy today. All right, let's get started. All right. How do I advance? Do you know how to advance this next slide? Sorry about that. Get started. Let's see. Okay, there we go. All right. So before we get started about health and wellness, which I'm really grateful to talk about today, we want to talk a little bit about the basics of myasthenia gravis. The one thing we have to realize is that it's a really not an issue with the nerve or the muscle, but it's a problem with the impaired connection. And when there is an impaired connection, there's a problem with the communication. And as a result, you guys must feel fatigued. You have problems with energy, fluctuating weakness, and lack of endurance. Can I get a raise of hands? Who here has myasthenia and has all these symptoms? I want you guys to interact, ask questions. This talk is for you. So today, I did get a card. Who has this card here? Uplizna, it's a new medication. I do respect, there's Johnson & Johnson. I know all the meds for myasthenia, and I respect all of them. Today, we're going to talk a little bit about the non-medication approaches. Okay, so this is health and wellness. Now, I will touch up on the meds at the end, but today is a little bit different. So how we're going to go about doing this is, the first thing we're going to talk about is mental strength. Okay, the rest, we're also going to talk about exercise, energy. Many reasons. Now, here are some things that I hear from my patients all the time. If you guys have additional thoughts, I want you to write them down. You can even tell me. But things like, I'm not good enough. I can't be happy. I can't travel. I'm not like everyone else. I don't deserve a full life. My life is limited. Medications may harm me. I'm too tired to enjoy life. Can't exercise. Doesn't matter what I eat. They may feel real, but they can limit your life more than anything else. So the mindset really can amplify your life, make it better or make it worse. So one of the things that we have to remember today is if every day it's an active exercise to really be aware of your thoughts. You should write them down, be honest, and tell yourself that you're going to have to reset. Okay, not only do we want to reset our physical body, but we want to reset our mental capacity. And so anytime we have a negative thought, we have to replace it with a thought of self-love, self-care, forgiveness, positivity, belief. Okay? Don't believe the thoughts that you have. Train your mind to make it positive and energetic every single day. Because at the end of the day, you are your own thoughts. You generate them. You generate your emotions. You generate your actions. You generate those outcomes, and you live with the results. So the mental strength part is really within you. Now, you might ask me, like, why do you care? Like, we have so many meds to talk about. You have real problems with weakness. Why should we care about our thoughts? Right? Like, who cares if I say I'm not good enough? Who cares? The reason why is because it directly affects your health. It truly does. If you have a mindset full of negativity or even a little thought that is not positive, that limits you, that will increase your stress, it'll drain your energy. Your energy is already drained. So you're going to add more to that. It could even worsen your overall health. So the first thing you have to do is protect yourself first. Not every thought deserves your attention. So you have to be very good. I'll tell you personally, every single morning, I just weed out the negative thoughts. I will. I will make sure that my mind is clean, happy, and positive. So make sure you let go of things that don't serve you. It sounds easy to do, but it is very tough because everybody goes through it. And you should keep your life simple, especially if you have myasthenia gravis. Simple thoughts, simple routines, simple habits. Keep your life in a very, very easy way because your body is not being easy. All right? Positive thoughts are like your best friends. And that's one of my favorite statements. So one of the things I want to say today, now we have to do this together, all right? We have to say this loudly and clearly, full of energy and full of positivity. Okay, repeat after me. I am full of joy. I want to hear it loud. I am full of joy. I am resilient. Oh my God. A little bit louder for the third one. I can conquer anything. Awesome. One more time. I can conquer anything. Perfect. Now that's the mental state we want to be in. All right. So now we're going to talk a little bit about exercise. Now, how many times have we heard exercise? My patients come to me every single time and say, Dr. Jerath, do I really have to do physical therapy? And I look at them and I say, no, you don't have to do physical therapy. It's okay. But you do have to exercise. And I'm not saying exercise like running marathons, but it is to be, in some ways therapeutic. So we don't want to increase an exacerbation, but we do want to make sure that exercising maintains strength, maintains, improves the kind of, studies have shown it reduces fatigue, and you're actually have improved walking ability and quality of life. So really important to have that exercise. It improves the muscle endurance and helps you even with sleep anxiety and depression, improves confidence. It can treat both the body and mind. So very important to keep that exercise up. What is important is to be consistent with the exercise. You don't have to do a lot every day, but just a little bit so you can maintain your muscle health. Things like a little bit of walking, cycling, or swimming, sometimes even a light weight or band or stretching or yoga. And you want to start a little bit slow. It's fine. You don't want to have to exercise to exhaustion. So when my patient told me she was going to PT and she was exhausted, I said, don't do that. Just do what you can so you can keep your muscles healthy. And that could be just simple as stretching, just to keep the muscles active. We do want to have interval trainings. If you're overdoing it, make sure you build in rest, and don't try to keep yourself fatigued. Make sure, again, that consistency is important. We have to remind ourselves what happens if you don't exercise. See, pause and ask yourself that one question. When you don't exercise, that's also not good. So that can decrease. You're already having trouble with muscle weakness and fatigue. So if you don't exercise, you can actually exacerbate that. You can also have decreased endurance and deconditioning. What I see a lot is people will gain weight, and then they may have risk for diabetes, high blood pressure, heart disease, and that can be more dangerous than the myasthenia gravis itself. And then I don't know, do people here have joint pain or back pain? Yeah. And sometimes that can be part of the myasthenia. We're going to talk about that later as a secondary effect of myasthenia, but the joint pain and the back pain, just because there's just limited mobility, there's limited endurance. So a little bit of exercise and stretching can go a long way. So that can really help reduce the secondary complications, improve your sleep as well. So if you don't do that exercise, it can be a little bit of a risk for your body. So make sure that when you do exercise, you do it so you can be energetic rather than fatigued with it. But then you also want to make sure it's protective for your body and it's not harmful. So make sure you do a little bit every day, even if it's a little bit of stretching, because avoidance will lead to physical decline, emotional decline, and even a worsening quality of life. The next slide, next topic is about energy. We all have energy, but we got to be very, very smart about conserving it. So too much energy expenditure can result in significant fatigue. And I know it sounds really common sense. This is what I tell my patients all the time. But what happens is that our energy is very limited. It fluctuates throughout the day. So you cannot expend the energy all at once. It's like a battery. So because of that fixed amount of energy, you have to spend the energy on what matters the most. So one of the things that I like to tell my patients is to prioritize on their most important activities, then plan. Schedule the activities during the peak strength times. Pace, which you probably automatically do anyways, but you want to work, and rest. Don't go to exhaustion. I've seen my patients go to exhaustion and then go into a crisis. And then instead of doing things like too stressfully, make things easy. Sit instead of stand and use assistive tools like shower chairs, an electric toothbrush, and even a meal prep aid could help and go a long way. So the right way is to actually pace and sustain and be consistent rather than to push really hard, crash, and then have a long recovery and come to me and say, Dr. Jerath, I need more prednisone. I get that all the time. Every time my patients will come and say, I overdid it. Don't overdo it. Make sure that you balance your mental energy as well. Try to avoid stress and anxiety, which drain the energy. Protect your sleep, protect your mood, and your mental bandwidth. So take some scheduled rest breaks and combine your tasks. Don't need to do less, just be smarter. I had a patient who came in and said, well, she was doing everything in the morning, shower, cooking, errands, and cleaning. And by noon, she was just wiped out. So what we did was we were like, let's make her shower in the morning, take a break, then cook throughout the day, and then rest in between. So that resulted in less fatigue and made her feel more consistent, and she had a better quality of life. She didn't do less, she just did it differently. This is one of my favorite patients. He was a 40-year-old a vet and was in the military, and he had myasthenia gravis. But one of the things that he did every day was he's so simple, so structured. And every single day or every other day with his wife would go and take walks at the mall. And so he didn't overexert himself early on. If his family wanted to come visit, he would say no because he was tired. He took appropriate medications and he improved gradually. I was surprised, well, not really. In 2 years, he was in complete remission. So his small, consistent habits plus his treatment was so consistent, resulted in powerful results over time. The patients that struggle a lot are the ones that are taking like overdoing it and then taking extra prednisone, over a month and then not being consistent with their meds. And so they just can't get into the remission that would really help them. So again, not doing too much or too less, but doing things differently and paced. So nutrition, you guys had a great lunch, I hope. You have a very, very positive outlook in life and positive mental thoughts, as well as exercise and conserving energy. We should be really very vigilant about what we eat. And I think this is a standard statement for life in general. But the better nutrition we have, the more optimized we'll have with our muscle function. There really is no single myasthenia gravis diet, but nutrition really will affect your energy, your strength, your weight, and your overall health. So food doesn't cure MG, but it helps your body function at its best. So what we need to focus on are lean proteins like fish and vegetables, eggs. They'll help with the muscle support. We also want to focus on fruits and vegetables and whole grains, as well as healthy fats. What I've noticed is some of my patients, because they're taking prednisone, they'll start eating like very, very bad foods. It's not good for them. So make sure you avoid the sugars. So small, frequent meals are important. Eat when you're the strongest, often in the morning. And if you need to, choose soft, easy to chew foods and sit upright. The common challenges are usually the chewing and swallowing fatigue, weight gain with steroids, and sometimes methadone causes stomach ache. So that can really be an issue. Important to, again, be very hydrated and avoid large, heavy meals. Do people know about magnesium here? Or so magnesium can worsen myasthenia gravis. I used to give it to my patients for cramps, but it sometimes can make myasthenia gravis symptoms worse. So it's important that we know those details. Plan your meals around your energy and prep food ahead of time. Some people have asked me about gluten-free diet. There's really not been strong evidence about that. So really important to be aware of what it is. We don't have any data, but there is some celiac association in the past. There's no evidence that it will improve the myasthenia gravis. When we talk about nutrition and supplements, some of the good supplements to take are vitamin D, calcium, and vitamin B12. That'll very much help your nerve health and your energy. Some people will take protein supplements as well. But again, we want to avoid magnesium and unregulated herbal products. I tell you how many times my patients take unregulated herbal products. They're coming from China or somewhere, and they're not. I don't even know. Has anyone heard of bladder from a cow or something like that, or random herbal supplements that very confusing things that people take and they don't pay attention. I had a patient that came to me for 3 years with muscle fasciculations and fatigue, convinced she had ALS, until her husband told me that he was making another cabinet in their kitchen. I said, "What is that cabinet for?" It was for all her supplements. And I said, "What are you taking?" She said, "I don't know. I'm taking everything I can find." So please be careful of taking supplements you don't know. And so as soon as we stopped those supplements, all her fasciculations were cured. So I told her to stop overdoing it. So, and in myasthenia, we have to be careful because some of the supplements will activate the immune system. So be nutritious and healthy, but also be careful what you put in. What I thought was really important was that there is some association of the gut microbiome and myasthenia gravis. And so, yes, there has been compelling evidence that the good bacteria, Clostridia, has been decreased in myasthenia gravis. So that increases inflammatory bacterial profiles. And what does that do as a result? So now there's an increased inflammatory bacteria stuck in the stomach and the gut. And so it will actually decrease the short chain fatty acids, decrease regulatory T cells, and increase autoantibody production. So we have to think about the microbiome patterns. There is some correlation that may occur with myasthenia gravis severity and may serve as biomarkers in the future. So it's really an exciting area, but we just don't have enough evidence. So we have to think about this. There's trillions of bacteria in the gut. They help regulate immunity and inflammation and some potential connection there. But, right now we don't have enough evidence to say probiotics are excellent. Same concept here. What we want to do is support a healthy microbiome. So that's one thing you can take home today if you don't have that knowledge. You want to eat a fiber-rich diet, include fruits and vegetables, stay hydrated, avoid unnecessary antibiotics, and then make sure that you have a good microbiome. So if probiotics is something you want to take, it might be good for your gut health. All right, secondary effects. We had some people having back pain, joint pain. So many things can happen as a result. I'll tell you from the beginning of all my patients, I would say that I spend so much time with my patients because I have to decipher if their pain is from myasthenia or not. So myasthenia gravis is obviously muscle fatigue and weakness, but can cause issues with problems because of medications, side effects. We overcompensate with our bodies. Reduced activity can occur as a result of myasthenia, as well as chronic illnesses. So not everything is directly related to myasthenia, but much of it is related to living with myasthenia gravis. So what we have to recognize is things like weakness can cause pain, which then can cause poor sleep. Weakness can cause incontinence, which then can cause anxiety. And weakness can cause fatigue, which can cause depression. So as a result, we have so many secondary symptoms of myasthenia gravis. And it's very important to go to a physician that knows you well, that can say, "Oh, this is not just a headache. This is from the neck strain due to the weakness of your myasthenia that's causing the headache." Or you have fatigue beyond the weakness. Sometimes people have diarrhea reflux as a result of the meds, or they'll have bladder dysfunction or joint pain and deconditioning. So these symptoms are really important to think about carefully. Why? Because we want to make sure that your myasthenia is being treated optimally. So recognize the patterns, think upstream. Is the myasthenia controlled? Review all your medications, screen for overlap like thyroid disease, autoimmune disease, and don't just treat one symptom at a time. So can myasthenia gravis cause pain? Who here has pain? A lot of my patients had pain. Oh, there was just so many of my patients had pain. Yes. And half the time it was because it was not directly from myasthenia, but it was indirectly, which is so common. One of the things, imagine neck weakness can cause strain in the neck and result in occipital neuralgia. And that can be misdiagnosed as a migraine, and it's not correct. So myasthenia doesn't cause pain directly, but it causes it indirectly. So if you have neck pain, make sure you think about it carefully. Could that be a worsening myasthenia gravis? Could it be a sign of a myasthenia flare? So secondary symptoms can reflect suboptimal myasthenia gravis control. Sometimes myasthenia gravis results in decreased mobility. We did talk about exercise, but not everybody can exercise to the levels that they need to, or they just don't feel mobile, or they feel exhausted. And so because of that, and then the prednisone added on to everything, it can cause weight gain and joint pain and bone loss and disc disease and radiculopathy. So one thing leads to another. So sometimes the new symptoms that you might have might be downstream myasthenia gravis effects. And think about the side effects of your meds, like Mestinon can cause cramps, diarrhea, urinary issues, and steroids, obviously the weight gain and the osteoporosis. One of the things that I want to keep emphasizing here again is when you have all these symptoms, decreased activity and just feeling fatigued, all of this can result in long-term issues like high blood pressure, diabetes, and high cholesterol. Now, this next example is that I had a patient, it came from a very painful moment in my career. A patient had, so we have to remember that some of my patients didn't like taking a lot of the immunosuppressants. They like prednisone. So prednisone can cause the weight gain, the blood sugar, the blood pressure increase, fluid retention. We have to remember that it affects the heart. And the reason why I bring this up is I had a patient, and I always promised that when he goes to Hawaii, he would give me a gift because I told him he would get better to go to Hawaii. But one day his wife called me in the middle of the clinic and she said, Dr. Jerath, my husband's short of breath. I was like, you have to take him to the hospital now. And he said he's refusing to go. He said it's a myasthenia crisis. And I said, I don't think it sounds like that. Does he have chest pain? And he wouldn't tell anybody if he was having chest pain. So all of a sudden, I said, take him, or he refused. And there's a back and forth we had on the phone in the middle of my patients. And the next thing I know, she told me he wasn't waking up. He had died. And that was the worst feeling in the world because he had had a heart attack. And so remember, your shortness of breath is not always myasthenia, especially if you are taking prednisone at high doses or at risk for heart disease. So always go to the hospital if you're short of breath. It could be a blood clot or another emergency. And since that day, I'll never forget, like, prednisone is not an easy drug to give. And you have to remember that low doses sometimes are better. And actually, we will be talking about the new meds that are out there. So make sure you go to the ER immediately. Do not wait. Don't assume. Don't push through. So this is my patient who had the heart attack, and I'll always remember that story. So symptom cascade, you'll remember that you have in primary myasthenia, you have the weakness, but again, there's secondary effects as well as tertiary effects. And always remember that. Now, one thing we talked about today was positive thoughts. We should always reduce that stress. There are studies out there that show that depression correlates with myasthenia gravis severity. So we have to be careful for just not, and it's not so like not be depressed. That's not an easy thing to say because obviously the disease can cause depression, but at the same time, be aware that depression is not something that's good for the disease. So if you feel depressed, get treated because if you have depression or stress, that will predict a higher relapse. Depression is not just a reaction. It's kind of a predictor of disease severity. So make sure you get that treated. So when you have secondary symptoms, they're real. Don't second guess them. They're often connected, and bringing them up helps you get better care. Now, a lot of my patients have brain fog. Who has that? Brain fog? Yeah. And everyone asks me, I'm like, okay, you're fatigued in your muscle. Why is the brain also fatigued? But the brain fog can be from the poor sleep, from difficulty breathing, from the medications, the depression, the autoimmune overlap. It is real and biologically explainable. I've tried the stimulants for that, and I've tried Adderall. Some of my patients feel better. So it does help, but not all. There's a difference between fatigue and then, being distracted like ADHD. But at the same time, give yourself the chance. If you need it, one of my patients continued to work in her job with the Adderall. So sometimes that helps your symptoms. Now, always remember that I've had this quite often. And some of you guys have autoimmune conditions, a lot of rheumatoid arthritis, thyroid disease, diabetes, lupus, Sjogren's. So make sure that some of my patients will see neurology as well as rheumatology. So if you have additional symptoms, be aggressive in looking out for that. Bladder and GI dysfunction could also be an issue, not primarily myasthenia, but could be from the medication, autoimmune, diabetes. And if you guys have a urinary tract infection or lung infection, that can worsen myasthenia gravis. Sleep, you guys know what I'm going to say about sleep. Sleep is really important. And the problem with myasthenia is that sometimes people have respiratory weakness. They might have sleep apnea, and they might have the medication side effects that will interfere with sleep as well as the pain. So there's a lot of things out there that can interfere with the sleep and that can cause worsening fatigue. Now, how confusing is that? It's so confusing because we know that myasthenia causes fatigue. If you're having bad sleep, it's only going to make things harder to figure out. So try to make sure the sleep is taken care of. That can make the weakness worse. It can make the brain fog worse and also interfere with the quality of life. Sleep is going to be critical. Obviously, we know that, and it may be one of the most powerful interventions in myasthenia gravis. Now, I'm not sure if anybody here is familiar with disability requirements. And the reason why I want to bring this up is I do think it's important for some patients to know. I've had a lot of patients ask me, like, Dr. Jerath, what about disability? And it's really important. Like, if you are interested in disability, it's important to know that significant motor weakness is one of the main criteria. So if you're interested in disability, come back and forth, like the fluctuating weakness doesn't qualify. And also just the diagnosis of myasthenia gravis doesn't qualify. You have to have some additional symptoms that will limit your day-to-day function. Speaking, swallowing, breathing issues, some cognitive issues that they want to see. You want to make sure that your symptoms are persisting despite treatment. Because if you don't have that, then they're like, oh, well, now you're treated. You should be fine. So a lot of these things require that sort of, persistent issues. Because myasthenia gravis is fluctuating, fatigue driven, and what SSA is going to consider if you're going to apply for disability is a consistency over time and ability to sustain activity. And what's going to strengthen your disability score is probably MG-ADL. Make sure that's documented by your doctor, clinical exam findings, hospitalizations, documentation of daily limitation, and your treatment history. Because if you don't have that, what most of the reviewers for disability are going to say, that was a one-time crisis. Now you're better. So don't think that in the MG-ADL score, if it's low, it's not going to cut it. So disability is based on functional impairment over time, not just diagnosis. Now, one of the most important things is that open-mindedness. My patients, I don't know why, maybe it's because I'm from Orlando. My patients are not open-minded to new meds. They were terrified. They said, oh my gosh, it's another medication, Dr. Jerath, and I'm going to get an infection and a side effect that I don't want it. And I was like, okay, so we're just going to keep micro-adjusting your prednisone until you feel better. So I had a lot of resistance to new meds. But we have to remember, of course, that the steroids are a little bit dangerous. They can cause weight gain and insomnia, mood changes, bone loss, and blood sugar elevation. And we really want to celebrate all the new meds that are coming out. So Basically, we know that the steroids can cause a vicious cycle with all their side effects. But really, every single day, I'm talking to patients and to people and about the new meds. It's so exciting. Now, I agree. We do want to wait. If there's a new med, just give it time, make sure there's no side effects. But, we've got the old school meds. If we really think about this, Mestinon, and remember, there's a short acting, I have extended release. Some of the kids who have myasthenia will be on liquid, and some of my adults like the liquid as well. And prednisone, of course, we know it's the lowest cost. You can get it the same day. And Cellcept and azathioprine and IVIG, these are the old school meds, but the newer ones are the FCRN inhibitors. These include Vyvgart, Rystiggo. I see Johnson & Johnson is Imavi out there. There's so many of them coming out, and more will be coming as we speak. So there's really good treatments out there that are more specific, have fewer side effects. Complement inhibitors, Solaris and Ultomiris, Zilbrysq, which is a daily injectable. B-cell therapy, some of my patients like Uplizna. Oh, that's on our card, right? So Uplizna, some of my patients have taken Uplizna. And it's a nice one because it's like once or twice a year. So it's kind of like rituximab. So for the chronic patients, those that have MuSK, myasthenia, it's got an alternative. Rystiggo is also for MuSK. So there's just a lot of variety out there. It's a lot coming out. There's BAFF inhibitors and CAR T therapy are also coming out. So there are more options. And what that means for you is that you have to ask because there's going to be more personalized treatments out there. Okay? Just imagine one treatment that you take can really change your life. So think about that. Be open about your symptoms. Be honest about what you can and cannot do. Work with your doctor to find what works best for you. A lot of my patients are like, doctor, just tell me what to take. And I'm like, okay, I'll tell you. But then if they ask questions, I want this, I want a sub-Q, I want to be independent, I don't want a vaccine for the complement, or some don't care. That's the discussion you start to have to take. Because if you just ask your doctor, you won't know everything that's out there. So make sure there's a little more of a discussion about the medication. Not every treatment is right for every person, but now we're getting kind of multiple options. I tell people it's like a buffet. You can go out and get a little more personalized treatments that are suitable just for you. All right. And our last one is our environment. How many of you guys been to a doctor that doesn't know anything about what you're talking about? So many, right? Make sure your environment is good. Your family members, your friends, your colleagues, they have no idea because one day you're good and one day you're not. So that type of awareness, you have to tell them, look, you may look fine, but feel exhausted. So just because someone said you looked fine yesterday, why are you tired again? Just push through it. Myasthenia gravis is just not always visible. Okay? So make sure you communicate openly, explain your limits, and set your boundaries when needed. Take care of yourself is the bottom line here. All right? I think we're done. Thank you.
Doctor, we have maybe time for one or two questions. And if you could check the Slido, the monitor right there to see if those questions are there. And again, just one, maybe two questions at the most.
Sure. Where are the questions?
It's down right below.
Would I recommend an anti-inflammatory diet to try and see if certain symptoms subside? Absolutely. Why not? I love the anti-inflammatory diet. I know there's one for myasthenia gravis, and I have all the books and the diets. I think they're just absolutely brilliant. So anything anti-inflammatory is right up your alley. It'll help in any way, and whether you have myasthenia gravis or not, it's a great choice.
Just one more question.
Sure. What lack of consistent exercise for muscle health do you recommend getting a bone density? Oh, with lack of consistent exercise for muscle health, do you recommend getting a bone density test? Absolutely. I do, and I think that should be a normal part of your workup. But that's, not just the lack of consistency. If you've been on steroids or if you're not outside in the sun, because a lot of times you can't tolerate the heat, not developing the bone health and the bone structure that you need. So I absolutely think the bone density is really good. So, and yes to probiotic yogurt. I keep wanting to answer questions. I know we're out of time, but I think you can take probiotics if you're on immunosuppressants. So, and the ketogenic is, I've not heard for the myasthenia gravis. That's more for seizures or epilepsy in kids.
Thank you, Dr. Jerath.
Thank you.
Thank you so much.
Thank you, Dr. Jerath. Okay, so we have a treat. Now we have breakout sessions. So I'm going to share the details around that to be helpful. So we're going to have two sessions, one with Dr. Sarah Wright on juvenile MG, and that's actually going to move to a room called Hemisphere Dancer, and that's actually right next door. So if you go out of this room and you just take a right, Hemisphere Dancer is going to be right there. It's a conference room that's just on the other side of this wall, okay? The other session is going to be with Kettia Alusma-Hibbert, and that's going to be on MG medication safety and real world management, and that's going to be in here, okay? So the other thing I was going to share is that we have moved dinner inside due to the wind gusts. Okay, I did pause because a number of you had come up to us, so I thought that that would make you happy. I'm sorry it won't be outside, but they are expecting pretty bad winds. So dinner will be inside, and it will be in here in this exact room. So and we'll see you. Jenna, is that 5:30 or 5:45? I didn't bring my phone up. 5:45 in here for dinner. Okay. All right. So for those of you that were going to the juvenile MG, we'll just take a pause so you can get up, and then we'll do introductions to the other one.
Yellow diamond in the light, and we're standing side by side as the shadow crosses mine. What it takes to come alive. The way I'm feeling, I just can't deny.
Okay, I think we have it. I mean, we have some people moving around a little bit, but in the interest of time to stay on the program, I think we can get started. All right, so this session is MG medication safety and real world management. Just to tell you that again, so make sure you're in the right place. And our speaker is Kettia Alusma-Hibbert. Kettia is doctorally prepared, board certified nurse practitioner. She has a specialized certification as a neuroscience nurse. She has over 16 years in her. Currently practicing as a neuroscience nurse practitioner focused on managing and treating patients with complex neurological conditions, including MG. She is driven by a commitment to helping patients with MG live their fullest lives despite their diagnoses. And she's the proud mother of 2 young daughters. Welcome.
I'll try that too. Hello, everyone. I'm supposed to see. Where do I see the slide? Is it going to be this? Perfect. All right. Thank you, everyone, for joining me today. This opportunity came about by one of my colleagues, Dina Rodney, outside of Maitland, Florida, who recommended for me to do this lecture. And I was like, okay, this is amazing, where I can get a chance to speak with more patients and kind of give the insight as a clinician, what I hope that all of you get experience with your neurology provider. So I have no financial disclosures, and I just wanted to make note that the information in this presentation does not substitute for medical advice or treatment. Please talk with your healthcare provider about your medical conditions. So the intent for this lecture is to kind of make it where I could be impactful, some things you can remember and hopefully take back with you if it's something that you haven't been presented yet by your neurology provider, that it will benefit your treatment plan. So we'll be discussing practical medication considerations, safely managing side effects, and some real-world scenarios before the question and answer section. Key points that you'll see the slide again, but this is so imperative, not only just for MG, but all of your healthcare providers should know all of your diagnoses. Every single provider. There's oftentimes where I have conversations with patients where they omit things thinking, oh, well, you practice neurology, so it may not be important for the intensive purpose of that encounter. But it's so important, even if you have a toenail that is gangrene, just giving a random example. Every provider should know all of your diagnoses. Every provider that you see should know all your prescribed medications. In addition to that, all of the over-the-counter medications that you're taking and all of your supplements. Sometimes patients don't equate supplements as a medication. As the presenter before me explicitly stated, it's so important because that young lady who had the fasciculations thinking she had ALS, it was as a result of her supplements. So it's so important that we know every single thing that you are taking to promote good health for you. And how do you take those medications? Because sometimes when patients are coming in and they're having either what they think is side effects or progression of symptoms, it could be that what the provider has intention for you to take is not how you're taking. For instance, pyroglustamine, Mestinon can be taken every 4 hours. That doesn't equate to you waking up in the middle of the night to take it, but we would like to know how are you taking the medication. Therefore, we can set up the expectations correctly. This slide, which you guys have been inundated and understand what the pathophysiology of myasthenia gravis is, and just to put it into context, when you are having some medications that you're taking for other diagnoses, this is how it can also impact on top of the antibodies that you have at the neuromuscular junction. So the most common one that we'll start off with is magnesium-containing products. And it's not necessarily the over-the-counter supplements, which they too can have some potential impact in your treatment. Because if you think about it, if you're taking magnesium or the supplement, it's probably because you need some help with sleep or some indigestion issues, gastro issues. So those things can relate to how impacting how your symptoms are. But most specifically, what people may not think of is when you're taking magnesium intravenously, because those are a larger dose of magnesium, so it really can impact. And if you're thinking about what this medication can do is severe weakness. So if you're getting an IV, headache, migraine, these medications, aside from myasthenia gravis, has the side effect of fatigue. So it's so important when you are taking these medications for whatever reason that you're explaining to your healthcare providers, I'm taking my propranolol, Inderal, and I just noticed I'm more tired. Is it at the same time that you're taking your Mestinon? Is it in relation to anything else? So they could really deep dive and really understand. So I've listed here Inderal, Topol, atenolol, labetalol, which are common beta blockers that are given, and some calcium channel blockers that we in neurology typically do verapamil for migraine prevention, but I often see with my patients when we're doing medication reconciliation, cardizem, Norvasc, and Procardia. Some other common drugs that manage symptoms are antibiotics. I want to stress the black box warning for the fluoroquinolones because, people often are getting sick and they may go to an urgent care or their primary care provider. So going back to those key points, it's so important that every single healthcare provider knows your diagnoses and medications that you're taking. Specifically, what comes to the fluoroquinolones, back in 2011, the FDA placed this black box warning because there was a lot of issues happening with patients with myasthenia gravis that they could identify. So it's very important that if you do need to be taking those medications, there's a collaboration with your neurology provider and whomever is prescribing, if possible, because we would like to avoid giving you Cipro, Levaquin, and the other fluoroquinolones listed. Some other macrolides and aminoglycides, they sometimes are also given for upper respiratory infection, common cold things, bacterial, I should say, not for viral. So if you are prescribed those, not necessarily that you cannot take it for those subsets, but it's important that everybody is aware of your diagnoses, and how these medications after taking it may impact your MG symptoms. They may worsen after taking. And then some over-the-counter allergy. Did I do that? Okay, thank you. Some over-the-counter cold, flu, allergy medications that can make worsening symptoms for your myasthenia gravis can be, the different over-the-counter like zinc, echinacea. Echinacea is very common when you are sick. It's an herbal supplement. However, there's been a lot of understanding around it that it can increase the autoimmune activity, and which means the body mistakenly attacks its own self on top of the antibodies that you have. So you have to be very careful and making sure, hey, you know what? I'm feeling a little under the weather. Let me run this by my neurology provider to see if it's safe for me to take. As well as the allergy cold flu medications that have sedating effect to it, that has potentially caused difficulty with breathing, swallowing, and increased fatigue. And there are some of them, such as zinc, that can interfere with your immunosuppressants, mycophenolate, as well as azithromycin. So it's important that you provide that information to all your healthcare providers. Some honorable mentions, which you probably know already when it comes to the Botox, Xeomin, Dysport, Jeuveau, Daxxify for cosmetic reasons, but they're also utilized for clinical indications for chronic migraine, cervical dystonia, spasticity, as it relates to multiple sclerosis or post-stroke. It's important that, again, I probably sound like a broken record, all your healthcare providers should know, even if you're going to a cosmetic provider, they should know your medical diagnoses to see if it's deemed okay, appropriate to proceed with that treatment plan. Statins that we utilize for cardiovascular health have sometimes they have patients experience myalgia where there is muscle cramping, weakness, and whatnot. So it's important that if you are starting these treatments after receiving the myasthenia gravis diagnosis, that you are collaborating with your cardiologist as well as your neurology provider to let them know if you're having any side effects. Typically, if a patient has been on a statin way before their myasthenia gravis diagnosis, it shouldn't really impact them as much because they would have already identified those symptoms. But having those honest conversations helps the patients. The last two listed is utilized for malaria and often rheumatoid arthritis and leg cramping at night. So mestinon, pyroglustamine, is typically one of the first medications once your neurology provider identifies that your clinical presentation aligns with myasthenia gravis. You can pick it up from the pharmacy same day. It doesn't require an extensive prior authorization and all this documentation. However, as great of a medication to access it has a lot of side effects. Nearly 2/3, 62% actually, of patients who take it report some impact of taking the mestinon. So how that sometimes can be non-beneficial for the patient is because if you're having the side effects of abdominal cramping, loose stool, flatulence, you may not be compliant with your treatment plan. Unfortunately, sometimes, depending on your symptoms and with your insurance, you may have limitations of how fast you can move along to the newer therapies, but we do like to utilize pyroglustamine because it is a quicker access, and it's having those conversations with your healthcare provider. I had a patient once who let me know she was taking the mestinon. We were getting her, we were in the process with her insurance of getting her approved for one of the newer therapies. However, her side effects were pretty brutal. She was at the mall and unfortunately had to leave the mall because of the loose stool where she had no control. So letting your healthcare provider know this and they can have it documented, which can help with the process of prior authorization. If they were considering, through shared decision making, if they were considering a new therapy, having that documented, because if you're not sustaining within the medication, if it's not sustaining you, we want to make sure that you're on a treatment that would optimize you as much as possible. Other reported side effects are bradycardia, bronchospasms, increased sweating, excessive lacrimation, muscle twitching, cramping are other effects. And sometimes too, with having these other side effects to the medications, patients will treat the side effects, not realizing we can get creative with the actual mestinon pyroglustamine. So there's that. Okay, so another medication that is often prescribed and it is easy to get access through your pharmacy same day is corticosteroids, prednisone. However, the first week of prescribing it, patients may have a progression in symptoms, their MG symptoms. Let's say you start off with just ocular symptoms and then you notice that it's a little bit more difficult to hold your head up and you're like, hey, what's going on? I'm taking the medication as prescribed. This is called the dipping in the corticosteroids world. And with time, you should have some improvement. It's the body adjusting to it. And with the exacerbation of symptoms, it's not necessary that you need to abort, but this is something that needs to be reported to your healthcare provider so that way they are aware. Some long-term side effects that I know the other presenters have said already is moon face, weight gain, increased blood sugar, insulin resistance, bone loss, osteoporosis, and broken bones. Immunosuppressants are other long-standing medications that we prescribe for patients that are easy to access, mycophenolate and azithromycin. These have side effects of blood pressure problems, fast heartbeat, swelling of the legs, ankles and feet, changes in laboratory blood levels, including high levels of blood sugar, nausea, vomiting, diarrhea, etc. And very important, if you're experiencing any of those, that you are letting your healthcare provider know so they could document, see that if it's appropriate for you to continue on with said treatment. Intravenous immunoglobulin therapy, we utilize it a lot. It's different access for patients in terms of like a monthly infusion. So sometimes patients would like to start off with that. The prior authorization is not as lengthy as these new biologics, and it allows for the patient every month to be getting infusion, or if they're not able to tolerate monthly infusions, to do subcutaneous if their insurance allows them. The most common side effect is headache. We try to combat that with prehydration, making sure that the patients drink plenty of water, and if it needs to be included with the regimen of intravenous bolusing of the patients. Other side effects that can happen is elevated blood pressure, which can be navigated with some antihypertensive, aseptic meningitis, blood clot, posterior reversible encephalopathy syndrome are kind of the more severe, and seizures. In my experience, I haven't seen too many of them, but it can happen. So if that does, again, please report it to your healthcare provider. Therefore, they can change your treatment plan accordingly. Plasmapheresis, most common side effect is lightheaded or faintness, changes in laboratory blood levels, lowering of calcium, vomiting, low blood pressure or muscle cramping. The plasmapheresis is one that is kind of resolved for port access. So they have either a tunneled catheter or a central line of some sort. And they sometimes need immediate attention because of infection or bleeding due to the central line access. So it's important that if you are having any adverse events to the plasmapheresis, that you notify your healthcare provider. And I wanted to list on this slide some of the newer therapies that are available to patients, whether it is intravenous or subcutaneous. And because these medications work a little bit different in the body and potentially can have lowering effects of your immunity or giving you rashes, depending if it's an injectable, it's so important that after you start taking the medication, you're identifying, okay, where's my MG symptoms at? Are they having any worsening of symptoms? What can I identify my body is responding to these newer therapies? Because if there is something that is happening, we need to see, okay, did you develop an upper respiratory infection? Are you having a UTI? Is there a welt that's developed that's worsening? Your healthcare provider needs to know to see if they need to change the treatment plan or if there's therapies that can help you. Okay. And I put this slide again because all your providers should know all your diagnoses. They should know all your prescribed medications. They should know all of your over-the-counter medications. They should know all your supplements and how you take them. I stress this so much because I have, in my experience, I have patients that will take Tylenol arthritis and don't think that it's important to notate until we're looking at their labs and their liver function is through the roof. And it's simply because they're probably taking a very high dose, more than what is recommended. So it's so important that all your providers know how you're taking all your medications for all your diagnoses. And that way, we can make sure that we're providing you the appropriate treatment plan to optimize you at all instances. So if you start feeling sick, it is very common with myasthenia gravis that you will feel weak because there's more stress on the body. So yes, you already have an underlying autoimmune disease, and now you've picked up a cold. How you should navigate through that is monitoring, knowing your actual baseline symptoms that you have. Are you having worsening of symptoms that need to be reported immediately, you want to make sure that you're resting, hydrating yourself with plenty of fluids, make sure that you're eating well-balanced meals, try not to do herbal supplements. As I stated before, the echinacea and zinc, as amazing as they are, they may worsen your symptoms. So you want to make sure that, you're trying to do things that to help you get back to your baseline, but not cause worsening of symptoms. If you present to an urgent care, which these people do not have long-term relationship with you, it's just for an urgent emergency, you need to let that healthcare provider know that you have myasthenia gravis. And ideally, if you have an updated medication list, that you can provide them so that way they know what is appropriate to prescribe for you, because giving you Cipro or a Z-Pack potentially can cause you go into a myasthenia gravis crisis and lead to hospitalization. And it was only the intent of getting, your cold managed. If you're going to your primary care, even though they are your primary care, but if you're not regularly going to them often throughout the year, and maybe it's only for your annual visit, you want to remind them that you have the diagnosis of myasthenia gravis and that they're inputting that into the system, because everybody's EMRs now have features where it can also remind the providers that, okay, your patient has this diagnosis, it's contraindicated to prescribe this said medication. And obviously, after seeing either urgent care or your primary care, if you want to run it by your neurology provider, hey, I was prescribed this, what are your thoughts? You can have that dialogue with them. So if you can get on with a telehealth visit to quickly speak with your provider, that would be amazing. And I wanted to note the last thing, hydrochloroquine, Plaquenil was widely discussed during the COVID-19 global pandemic, and everyone was trying to, navigate that as best as possible. But what it can do is cause more muscle weakness. So you want to make sure that you're not just taking some medications without your healthcare provider not being aware. When you are preparing for surgery, you want to make sure that you inform the surgeon primarily that you have myasthenia gravis, the anesthesiologist, because they will probably be giving you a neuromuscular blockade if you're going under general anesthesia to intubate you. So it's important that they are aware, because if there are things that they need to be in preparation for with the intubation and extubation, they have the proper tools ahead of time, as well as the healthcare team. Yes, the physicians are very important, or if you have a CRNA for anesthesiologists, but you want to make sure that the nurse, the check-in person, anybody who will listen to you, that you explain to them you have myasthenia gravis, and that everybody part of your journey and your surgery is aware, so that way they can plan accordingly. And then you want to schedule with your neurology provider prior to the surgery, so that way if there's any clearance that needs to be given, and typically there's some forms that is coordinated between the surgical team and your neurology provider just to give clearance to have that written off. But you want to have that conversation with your neurology provider to make sure that if there's anything with your treatment plan that you're taking, let's say you're on IVIG, the immunoglobulin intravenous treatment, and do you need to space out your surgical date with your infusion, or if you're on one of the newer biologics, is it okay for me to take my Vyvgart, Hytrulo, and then go for surgery? These are conversations you need to be having with your neurology provider. And post-surgery, you will also have that discussion of when can I resume? So I didn't take my Resigo today, when can I resume afterwards? What do I anticipate in that time of waiting? What does that mean in terms of like my MG symptoms? Do I anticipate that my symptoms will worsen or not? So having that conversation, and also noting that your corticosteroids, depending on the surgery, may be delayed to resume shortly after. Okay. As it pertains, and I know the presenter before gave a lot of great information about gut health, You want to make sure that you are taking fiber, you're drinking plenty of water, taking a probiotic daily to help kind of navigate your baseline gut health. Some of the medications cause, some GI issues, typically not constipation. It's more so loose stools. But if you do develop constipation, or if that's just your baseline, aside from the myasthenia gravis, you are making sure your baseline probiotic, fiber, plenty of water, those things are part of your daily routine. And not taking hycosamine, as that may cause you to have worsening symptoms where you may go into a myasthenia gravis crisis. So it's so important that you are notating whatever symptoms that you were having prior to your MG diagnosis, as well as medications if you are having side effects, and communicating that with your healthcare provider. And lastly, knowing when to call your provider, worsening of symptoms, new symptoms, breathing difficulty, because that is an emergency, and any side effects to the medication. You want to make sure that you are tracking this. MGFA has a wonderful app that I see right now. They're having some issues with Google phones, but Apple, it's still available. I encourage all my patients, as we navigate their myasthenia gravis journey, to always track their symptoms, because you guys live with yourselves every day. Healthcare providers only get a snapshot at best. We could probably get 40 minutes in, and you live with your symptoms day to day. So if you see you have fluctuating symptoms throughout the day, after you take medication, if you can notice something, it's so important, because within that app, you can track your symptoms and then bring that as a diary to your healthcare provider to discuss at your visit. Okay, and that's it for my talk.
Raise your hand for questions.
Is there a link or a website that will, I'm a caregiver, so I'm just curious about some of the things we do, a lot of at-home care. And one of the big situations is my wife gets sinus infections quite easily, chest infections. So, we typically try to combat things with some Sudafed, some Mucinex, that type of thing. Is there anything that is a quick go-to where you can just kind of review, do these particular over-the-counter meds have any ill side effects for people with MG?
So it's very unique patient by patient, because if your wife has had MG for a while and you guys have used Sudafed, so in your case, it's not something that would be contraindicated. But maybe for somebody who's newly diagnosed, they may want to err on the side of caution, because this can impact their MG symptoms. Obviously, this is something to discuss with your neurology provider to let them know, like, hey, I've been doing this. I kind of notice I have weakening symptoms around this time. Is there anything? Is it the Sudafed, or could it be that it's a sinus infection? The body's under stress, so potentially that could be the why. So have that conversation with your healthcare provider.
Kettia, are there questions on the Slido too? There might be a couple that have come in, if you can read those.
Yes, similar to the previous question, over-the-counter cold, how do you fight a common cold? Rest, hydrate, well-balanced meals, just the basics. Because it's the common cold, oftentimes is viral. Now, if it's bacterial, that's another question that, with your primary care provider or your neurology provider, they can collaborate. But it's what's appropriate to you. So going off the previous question too, if a patient has had, let's say, MG for the past 20 years and they've taken Cipro without any issue, then it's no problem. They can continue on. But if you are newly diagnosed and you notice my healthcare provider had prescribed the Cipro and I'm having worsening symptoms, I'm now in a crisis, we can identify that is the cause. Do I have an opinion on Zepbound with MG for weight loss? I do not have an opinion on that. I think whoever's the provider that would prescribe it for you, because Zepbound is indicated for obstructive sleep apnea, which could benefit you, as well as for weight loss. So it all depends on why the person is taking it. But these are conversations definitely to have with your healthcare provider. And I talk with my patients all the time, like, hey, if you're having difficulty with sleep and let's do a sleep study. Let's see what's going on. And if Zepbound is indicated for them, there's no contraindication. It does not reduce anything in the neuromuscular junction, to my knowledge. But please talk with your healthcare provider. Okay, you mentioned avoiding IV magnesium. Is there another medication option for treating women post-birth if they develop eclampsia? That will be for your OBGYN provider to prescribe. And then two, if it is in a critical situation like that, they should know that you have myasthenia gravis so they can anticipate after giving you the intravenous magnesium, how do we counter that? Because it may precipitate your MG symptoms. What is the care plan afterwards to make sure that you're stabilized? Because eclampsia is life or death. So, all great questions. Anything else?
Kettia, thank you so much for your time.
Thank
you
you.
very much.
Thank you.
So now we're taking our break and see you at dinner tonight, 5:45. 5:45. Please visit the experience rooms and the sponsor and partner exhibits. And thank you so much. Thank you.